Detecting chronic kidney diseases and predicting one's biological age with just a scan of our retinas. It's now a reality thanks to scientists at the Singapore Eye Research Institute. Well, they've developed two tools, RetiKid and RetiAge. Artificial intelligence is used to scan photos of a patient's retina. And the tools are non-invasive, and the scientists say effective as well in detecting possible health issues even before symptoms emerge.
And for more, we are joined by the principal investigators of each tool. Ching-Yu focuses on RetiAge and Charumati Sabayanagam on RetiKid. Now, Professor Charumati, let's just begin with you. They say that our eyes are the windows to our soul, but how exactly do they shed light on our health?
Because the retinal microvasculature, which means small blood vessels in the retina, they mirrors microcirculatory changes happening elsewhere in the body, like those microvascular changes in the brain or kidney could be reflected in the retinal microvasculature. And while brain and kidney microvasculature cannot be accessed readily, retinal microvasculature can be visualized directly and non-invasively using a digital retinal photo. So just a simple scan of the eye could provide clues to systemic microvascular disease. So, yeah.
Well, Professor Charumati, existing screening tools for chronic kidney diseases exist. So how does RetiKid complement and perhaps enhance these existing tools, and what are the symptoms that you're looking for?
So current screening tools for chronic kidney disease include a blood test to assess the serum creatinine level and also urine test to assess the presence of protein or albumin in the urine. Although these tests are widely available, compliance to screening for chronic kidney disease using these tools are low, even in high-risk countries and also in those at risk for developing chronic kidney disease. So by offering RetiKid as a first-stage screening tool, it can improve compliance to screening because those who test positive by RetiKid will be more convinced to go for further blood testing. And also RetiKid identifies and stratified the segment of population that are really at high risk of developing chronic kidney disease. And so up to 2/3 of individuals who test negative by RetiKid can be safely avoided for further blood testing. Thus, there is a huge savings on manpower cost needed for screening resources. And also, number of visits for patients are reduced. For example, to do blood test, a patient has to go for at least 2 visits, one for blood testing and the other visit for review the blood test results with the doctor. With the RetiKid, the results will be available within 1 hour on the same day. Thus, a number of patient visits will be reduced, which saves again patient time and cost. And finally, with the increasing prevalence of diabetes and hypertension, and also aging of the population, the screening demand for kidney disease will increase. And due to the blood test and urine test resource constraints, we cannot meet the rising demand of this higher screening. And also, currently, only those with the diabetes and hypertension are being screened for chronic kidney disease. There are other high-risk populations, like, for example, Malay ethnicity, and also those who have a history of a stroke or heart attack, and also those who have family members who are on dialysis or transplantation. They are also at high risk for chronic kidney disease. So RetiKid being non-invasive, it could be easily scaled up to screen higher number of people and those who are at high risk for chronic kidney disease.
Or perhaps let's bring in Professor Ching. RetiAge, now that measures for our biological age, but I'm wondering, how does this differ from chronological age, and why is this distinction so important?
Thank you for having me here. So basically, chronological age is based on your birthday, listed on your NICs. But biological age is different. It tells us about the age of our body cells and our general health status. And it reflects a combination of genetic factor, lifestyle factor, and other determinants, such as exercise habit. So measuring biological age is an effective way of determining how age process has affected our bodies. And knowing your biological age is also a key step to have a better understanding on your health profiles.
Well, Professor Ching, what are the health concerns and the signs of aging that you're looking out for during the screening? And what can patients do to mitigate those health impacts?
So, based on our research, right, we show that RetiAge, right, can be used to predict mortalities. So compared to people with younger RetiAge, those with older RetiAge had double the risk of 10-year all-cause mortality, triple the risk of cardiovascular mortalities, even though the two groups had the same chronological age. But the good news is that biological age can change. Once a person is identified to have older RetiAge, they can take further steps to improve their lifestyle habits, such as do more exercise, get proper nutrition, and stop smoking, and so on.
Now, this is really interesting, and I'm wondering if I'm one of those who can actually be tested for this. But who exactly, is the target population you're looking at to receive screening via whether it's RetiKid or RetiAge? Professor Charamurthy?
Yeah, for RetiKid, those who are at high risk for developing chronic kidney disease, like those with the diabetes, hypertension, family history of chronic kidney disease, that is having family members on dialysis or transplantation, and those with the history of heart attacks or stroke, and also Malay ethnicity, because Malay ethnicity has been identified to be a high-risk population for chronic kidney disease. So these are the target population we are looking at. We are looking to screen for chronic kidney disease.
And Professor Cheng, perhaps you can tell us when and where we can see RetiKid and RetiAge being rolled out for mass usage by medical practitioners.
So for the RetiAge, right, we will perform a validation study in our local population. And after that, it will be have to be approved by the Singapore Health Science Authority before it can be used in the clinic. And we will deploy the RetiAge and RetiKid in the polyclinic because in our current polyclinic, we already have a retina camera available. So it can be built on the current infrastructure and facilities.
Well, thanks very much for staying up late for this interview, Ching-Yu and Charamurthy Sabayanagam from the Singapore Eye Research Institute.